My name is Helka Kaunisto, and I research dermatitis herpetiformis in the celiac disease research group in Tampere University. So, celiac disease is an autoimmune disease that is triggered by the ingestion, so the eating of gluten, which is found in wheat, barley, and rye. And about 2% of the Finnish population suffers of celiac disease. And although celiac disease is known as a gut disease, an intestinal disease, about 60% of celiac disease patients also suffer of extraintestinal manifestations, so symptoms outside of the gut. And the most common of these extraintestinal manifestations is dermatitis herpetiformis, in which the patients get a blistering rash, a symmetrical blistering rash on the skin when they eat gluten. And the main autoantigen in celiac disease is an enzyme called transglutaminase 2. And antibodies towards this enzyme can be found in the bloodstream of the patients, and they're also used for diagnosing celiac disease. In dermatitis herpetiformis, in turn, the main autoantigen is an enzyme called transglutaminase 3, which is closely related to transglutaminase 2. And this enzyme is found in the skin of the patients, near the rash, and also antibodies are found in the skin as well as in the bloodstream. But perhaps most interestingly, there's a subgroup of patients with celiac disease who also have anti-transglutaminase 3 antibodies, but they do not have a rash on the skin when they eat gluten. And so my research focuses on why do not all celiac disease patients develop dermatitis herpetiformis, even though they might have antibodies against the transglutaminase 3, which is found in the skin of dermatitis herpetiformis patients. And although both dermatitis herpetiformis and celiac disease begin in the gut, the initial inflammation is in the gut, it's not very well known how the inflammation is transferred into the skin, what causes the skin reaction. So I aim to find out how dermatitis herpetiformis works immunologically by answering 4 questions. First of all, as I said, why do not all patients, celiac patients who have transglutaminase 3 antibodies, why do not all of them get dermatitis herpetiformis? Secondly, how is the inflammation in the intestine relayed into the skin immunologically in dermatitis herpetiformis patients? Thirdly, what characterizes the inflammation in these sites of the intestine and the skin? And are there similar factors involved in both spaces? And fourthly, and more broadly, what is the difference in the immune responses between celiac patients and dermatitis herpetiformis patients? And I'm conducting this research by using patient samples that Celiac Disease Research Center has collected. And I'm using methodologies such as RNA sequencing and confocal microscopy to answer these questions. And hopefully, by the end of my PhD, I will have brought some understanding into why some patients with celiac disease develop dermatitis herpetiformis and what immunological factors drive this development. Because I use patient-derived samples, I use the CSC sensitive data services for my data analysis.